As we enter the year 2022, we are more hopeful that we can go back to the normal lives we had before the COVID-19 pandemic locked our world down for the past 2 years. But even though we combat through the pandemic and had made significant progress through health protocols, lockdowns, and administering vaccines, it seems that the virus is adapting to us as much as we are adapting to it. And we know this by observing its variants. These variants are like COVID's remixes, a mutated version of the virus with varying danger levels, like greater infection rates to how much it amplifies the virus's effects on our bodies. We've seen some of these variants pop up in the long timeline of the pandemic. The Alpha variant documented in the UK back in September 2020, the Beta variant in South Africa in May 2020, the Gamma variant in Brazil in November 2020, and the notorious Delta variant that was first observed in India back in October 2020, where it ransacked the country during the course of 2020 to 2021, leaving thousands upon thousands of people dead. And now, our country has to deal with the newest COVID remix drop, the Omicron variant. Welp, there goes our progress. The Omicron variant, or B11529, was first documented in South Africa back in November 2021 and is observed to have two factors. One is it has increased transmissibility, meaning more people are susceptible to be infected than previously observed, and it has the ability to evade the immunity we have built up against the virus, either through vaccination or being infected by COVID before, and have our bodies develop natural antibodies against it. But on the slightly brighter side, its effects are observed to be more mild and not as bad as Delta's kind of damage, so most of those infected by the variant experience more mild symptoms than severe ones. Of course, this is still very concerning because as of January 6 this new year, the Department of Health confirmed that there are already 43 confirmed Omicron cases in the country, some coming from returning overseas Filipinos and some coming from local cases. So, what can you do to prevent this alarming situation from getting even worse? Well, it's simple really. Number 1. Follow minimum health protocols. Wear a face mask and wear them properly. Stay away from crowds and social distance from people as much as 6 feet away if you can. Always carry a disinfectant with you and be mindful of the people around you and the places you go to. Be in highly ventilated areas as much as possible and always disinfect your hands when outside. Number 2. Stay indoors as much as you can. As a student myself, I know that some of us are bored or uncomfortable to be in our houses all the time and want to go out, and most of our working class need to get out to their designated working areas to earn for a living. But, if you can and is possible, stay indoors and at home so you either won't get infected or be a carrier of the variant. Even if you think you are careful outside, COVID has time and time again proven that it can slip by someone letting their guard down and can cause another outbreak if not responded to early. And number 3, get vaccinated. If you can, please get vaccinated for your own health and the health of those around you. If you have a reason as to why you won't take the vaccine, the weight of that reason should be heavier than the risk of not taking one. Otherwise, please get vaccinated. We are responsible of our own health as we are responsible for others in this time of the pandemic. So yeah, Omicron's here. So stay vigilant and be responsible of your own actions. Thank you so much for listening. Stay safe and have a good one.